When it comes to battling cancer, one of the most effective weapons with which to arm yourself is information. In our continuing series on women's healthcare issues, Lorene Cachola gives us a look at the latest technology allowing patients to get a jump start on treatment and prevention.
To truly know Carol Rodman, you'd have to walk a mile in her shoes, or maybe even 3 miles if you join her at one of the many events in which she participates to raise awareness for breast cancer. Carol's journey toward cancer survival is a long, difficult one.
It was May of 2003, and I was at my gynecologist for an appointment, and she said, "How long has this lump been here?" And I said, "What lump?" And she sent me to a breast specialist, and he did an in-office biopsy, and it came back malignant. And I was surprised, but I wasn't shocked, because my sister had breast cancer at 37, and my mother had had it at 80. So I knew that there was a chance that I would get it.
A lumpectomy, radiation, and chemotherapy followed, and something else, a procedure called genetic testing, which Carol received at the West Clinic.
We take a blood sample, we isolate the genetic information or the DNA from the blood cells, and from there we focus or hone in on several genes.
What researchers are looking at are 2 genes known as tumor suppressors. These genes are BRCA1 and BRCA2. In normal cells, these genes help ensure the stability of the cell's genetic material, or DNA. However, if there is a mutation in either gene, there could be an increased risk of breast or ovarian cancer running in your family.
For example, the lifetime risk for breast cancer for a woman with a mutation in BRCA1 or 2 is a 50 to 85% chance. The chance for a second breast cancer, independent of the first, if she does the least amount of surgery to treat that first cancer, is about a 40 to 65% chance. And in addition to that, if she still has her ovaries intact, and again, she tests positive for a mutation, we know that she's got up to a 50% lifetime chance for ovarian cancer. So ovarian cancer is difficult to detect, therefore we recommend a preventative surgery to remove that risk.
In Carol's first genetic test, researchers found no evidence of a genetic risk. However, tenacity on the part of her healthcare team proved to be invaluable.
When the technology improved, I recontacted her several years after she was tested. She retested and had a hereditary risk proven.
So my options were to, wait and see, or to have my breast removed. And I opted for the mastectomies.
Armed with this latest information, Carol convinced several other family members to get tested to see if they carried the hereditary risk as well.
My brother came back with a positive mutation for breast cancer, so he's at higher risk for breast cancer and prostate cancer. My sister's 3 children came back with positive mutations.
The news that you have a hereditary risk of developing cancer is never easy to take. But for patients like Carol, that information provides a welcome relief in knowing that family members can be forewarned of the potential danger and take appropriate action.
For my nieces, one has been very proactive. She's had hysterectomy already, and the other one is planning on doing it by the end of this year.
Thanks to some very persistent healthcare workers and major advances in genetic testing, Carol's long journey toward cancer survival is right on track. For Smart Medicine, I'm Lorene Cachola.